Excruciating pain.
I'm not gonna leave this room until we do something.
Leads to a rare stage 4 lung cancer diagnosis.
And I don't wanna think about cancer. I wanna think about my family.
The science helping this marathon runner live with cancer.
I want you to know it's the most beatable and it's the most treatable, and you're gonna be okay.
And finding hope and a different approach in treating breast cancer.
Someone you love will live because of this cancer center.
I've got too much to live for.
What this woman discovers after seeking a second opinion. Welcome to Choices, Hope, and Science. I'm Jessica Lovell.
And I'm Alexis Del Cid. We're joining you from the Dolph C. Simons Jr. Family Broadcast Studio, where we have two powerful stories to share. Most of us expect to see the big moments in life, your kids growing up, graduating, even retiring.
But when you are diagnosed with cancer, moments like these, they come with a question mark.
For Euri Solis, a single pill is bringing back normalcy after a devastating diagnosis.
Ready, girls?
50-year-old Euri Solis is a husband and father to two little girls. He's also an avid runner.
I love running.
So when Euri experienced pain in his lower back, he thought no big deal.
Because the physical activity, I'm gonna just wait.
But his pain persisted.
So much pain. I couldn't do anything.
Doctors ordered an MRI, and that is how Euri and his wife Erin found out it was likely cancer.
Of course, we're in complete shock and worried, very worried.
I have some illness in my body, but I just want to go and find what is it.
Euri was referred to the University of Kansas Cancer Center Olathe campus.
I'll just have you on the end of the table here.
There he met medical oncologist Dr. Larry Coram and his team, who recognized right away that Euri's cancer was different and he was very sick.
For me, this was this really compelling sort of collision of science and emotion.
Euri, a non-smoker, was diagnosed with non-small cell lung cancer caused by a rare gene mutation.
So many of the people that sit in my exam room are dealing with the most significant, most important, and in many cases, most devastating thing that they've ever faced. Let's look at your scans here.
Dr. Coram helped Euri face his cancer, which had metastasized.
During that time, I was very scared. I didn't want even to read about cancer. He was one of the persons that mainly gave me some kind of hope.
But Dr. Coram knew that hope would require a village.
I'm a medical oncologist. I don't have the expertise and the knowledge and the skill set of a radiation oncologist or a thoracic surgeon or a cardiologist, which we needed in this case.
Scans showed that Euri had multiple lesions in his bones and on his liver, and there was more.
As you can see, this fluid or this blood is pushing at the right side of the heart.
Euri was admitted and put into the hands of cardiologist Dr. Jamil Abuzatin to remove the excess fluid, squeezing Euri's heart.
So if you see between the liver and between the heart, there's no space here. That black space is gone.
Next, Director of Radiation Oncology, Dr. Bertram Maidment III, was brought in.
It became clear with advanced imaging that there was something more to the story than just chronic pain.
Euri had 11 brain metastases, in addition to the massive pain in his bones.
His pain was so severe outside the brain and the body and the bone lesions that Dr. Coram knew he needed treatment immediately. He couldn't wait for something that might take weeks and weeks to alleviate pain. We needed to get going very quickly.
Dr. Coram knew Euri's rare ALK gene mutation qualified him for a medication to treat his very specific form of lung cancer.
Many of these people on just a pill, just a daily pill like he's taking, are going to be living years and years and years, and often in a complete remission.
Which is where Dr. Coram considers Euri to be living. That word, remission, brings the ultimate hope.
We were basically back to living our normal lives and didn't think about cancer 24/7 like we did in the beginning.
It's a new beginning for the Solis' story, and one that this team of doctors is blessed to play a role.
It always feels really good to know that the patient is doing well and what we've done for them is helping. So that's the best part of the job.
You go from this moment of terror, and feeling as though, this is my responsibility, right, to figure out how to get this person out of this, this predicament, to this moment of elation when you see the results and you're able to deliver that.
It makes us feel phenomenally good as a team to be able to have all the tools here to help people such as Euri lead a productive, happy life, to create more memories and to flourish.
We start Choices, Hope, and Science with Euri's story. Alexis explains how advances in science and treatment allow more people like Euri to coexist with cancer. Alexis?
We are so happy to be talking with Euri and his wife Erin today. And in studio with us is Dr. Larry Coram. He's Euri's hematologist and medical oncologist, along with Dr. Bertram Maidment III, the director of radiation oncology. Both doctors work at the University of Kansas Cancer Center. Thank you both for taking the time to join us, and thank you to Euri and Erin for joining us. Euri, I want to start with you because the images we're looking at of the cancer spread throughout your body are shocking. That's when you were experiencing your worst pain, yet speaking with you now, you look great. Do you feel as good as you look?
Yeah, you could see how, the spots, they look everywhere in the before image. And I think the baseline was the pain. And I'm feeling better now. I feel more, physically I'm different than before, but I feel better. No pain at all.
Dr. Coram, when we talk about the diagnosis, you hear the word lung cancer, you think smoking. Euri doesn't smoke. He's never smoked. In fact, Euri's a marathon runner. So how did you determine that his cancer was a genetic mutation? And then what's the name of that mutation?
Euri has what's called non-small cell lung cancer, which constitutes about 85% of all the lung cancers that we see. And of those non-small cell lung cancers, we know that about 15% of patients have never smoked. So actually, it was in part because Euri is relatively young and because he has never been a smoker that I was suspicious and actually hopeful that he may have one of these special driver mutations that makes these cancers much more treatable. But in the last 15 years or so, we've come to understand many of the molecular drivers behind these cancers, and so now we routinely do these special panels of molecular tests that we call next generation sequencing, and we did that in Euri's case, of course, and we found this relatively rare ALK gene mutation or ALK gene rearrangement that occurs in only about 5 to 7% of all lung cancers.
Dr. Maidment, you were part of the whole team of doctors that had to treat Euri's cancer before he could even start the cancer pill. Walk us through what the treatment looked like, particularly the journey through radiation.
We had to act quickly for his pain, which was severe in the lower back and hip in particular, and also the discovery of brain metastases. I believe Euri had 11 brain metastases that were ranging in size to over half an inch in size in several of them. And so we treated with 2 techniques of external beam radiation, which is a high energy X-ray, delivered by a machine called a linear accelerator, and he essentially had treatment on both ends of the complexity spectrum. We used a very old tried and true technique essentially with modern tweaks for the back pain over the course of 10 treatments. And then the brain treatment was the opposite, something very high dose focused called Stereotactic Radiosurgery, or SRS, so named because it is thought to have essentially surgical precision and sub-millimeter accuracy. It is a very precise way to treat brain tumors and extremely high rates of tumor control to prevent them from ever growing back.
This cancer was spread throughout his whole body, yet now, Dr. Coram, Euri can take a single pill to keep this kind of cancer from returning. How does that work?
Right, so the ALK gene rearrangement that I referred to, what that does is it produces it results in the production of an abnormal protein. And that protein is expressed on those cancer cells, and it drives the abnormal growth of those cells. And these oral medications, these ALK inhibitors, we call them, so-called tyrosine kinase inhibitors, they actually sit on that protein and block the abnormal signals from that protein. And so essentially shutting down the growth of those cancer cells, And when those cancer cells can't grow and spread, then they typically die off.
I want to bring Euri's wife, Erin, into the conversation. Erin, what's it like for you to, one, see these images, and two, essentially relive your husband's diagnosis?
I think when we see those images as of late, and then all the recent scans have come back stable, it just reinforces like what the doctors are saying, gives us a lot of hope that, you know, we don't have to worry as much. So the roller coaster has been a little smoother as of late. We've had a little more highs than we have lows. So yeah, we're doing good.
We saw your beautiful girls in the video. What do your children understand about Dad's cancer?
They didn't seem all that scared about it. They just, you know, they know that Euri's a fighter, so that he's brave, and they really don't ask a lot of questions. You know, Euri lives a normal life, so they don't really notice it that much. So that's been a very positive blessing as well.
We do have a few questions coming in from the community about genetics and cancer, and Cindy has a question for you, Euri. Cindy wants to know, what time of day do you take the pill? And have you ever forgotten to take your pill?
I take in the mornings and the evenings. I usually take it with food. I do remember missing the dose, I don't know, like a couple times only. I have this dispenser, which is weekly dispenser. So you could track every day how many pills and if you are taking the morning or the evening. So that's very useful.
Dr. Maidment, Becca has a question. Becca wants to know if Euri had to avoid other people when he was going through radiation.
Fortunately, in this case, he did not. He was able to lead a normal life the entire time. X-ray beam radiation is no longer radioactive about a millisecond after the beam is off, so it's treated the body, had its desired effect, and then no residual radioactivity in the body.
Angie wants to know if there are other cancers rooted in genetics that can be treated with a pill like Euri's.
Yes, there are. And in the last decade, you know, we have discovered quite a number of these important driver mutations, and with better chemistry and better understanding of molecular biology, have been able to develop quite a number of targeted agents. So it's changed very substantially in the last 5 to 10 years.
Okay, Euri, Jill has the question that we all want to know the answer to. Jill wants to know if you're back to running.
Right now I'm doing jogging. I will say jogging, but I'm trying hard and I will do it. I'm 100% sure that I'm gonna go back.
Dr. Maidment, thank you. Dr. Corum, thank you. Thank you both for coming down here. And thank you to Euri and Erin for joining and sharing your remarkable story.
Thanks, Alexis. Our next guest received a breast cancer diagnosis and came to the University of Kansas Health System looking for a second opinion. She found it, along with hope, at the Cancer Center. Now, that patient, Kerry Mooneyham, has an army of people supporting her. Kerry Mooneyham is a 58-year-old mom of 3 and Mimi of 4. She takes her health very seriously. Her mom was diagnosed with breast cancer.
I do it every year. I never miss a day. I'm never a day late.
Her mammogram this time was different.
They said they could get me in the next day for additional imaging.
Kerry wasn't in full panic mode yet. She knew she had dense breasts, which can create a false negative. But then the technician performing the additional testing abruptly delivered the news.
I said, "What do you think?" And just very nonchalant, "Oh, I'm 85% sure you have cancer."
It was a bomb drop.
And I said, "What?" And she goes, "Yeah, I'm 85% sure that you have it." And I could just feel the blood rush through my body. She had no empathy for me whatsoever.
The conversation left Kerry feeling unsure about her care and treatment options at that hospital. Her thoughts immediately turned to her family.
I'm telling you, it's the darkest place I've been, probably in my life. My kids are very strong, but when you see your grown kids crying, it's hard. It's hard.
Kerry wanted a second opinion.
Hello.
When she got in front of breast medical oncologist Dr. Ann O'Day at the University of Kansas Cancer Center, she felt immediately that she was in the right place.
Oh my gosh. This is how she sat with me. You have this, and she
held your hands.
I think she did.
She did.
You have this, And I want you to know it's the most beatable and it's the most treatable, and you're gonna be okay.
While the diagnosis was confirmed, triple positive breast cancer, "You're going to be okay," is all Carrie and her husband Scott needed to hear.
I needed somebody to confirm that I was gonna live. I've got too much to live for.
Treatment would, however, include 6 rounds of chemotherapy.
And then I'm ringing that bell, and it's gonna be the best day, and all my kids are coming. It's gonna be 2 seconds, but they're coming to watch me ring the bell because we're celebrating.
And that day came. Then Carrie was back for a double mastectomy,
How are you?
followed by breast reconstruction.
My relationship with Scott, so much stronger. I mean, we've been together for 40 years, but so much stronger. He's been such a rock.
She's also solid in her faith
Super proud of you. Thank you so much.
and thankful for the new her cancer has helped create.
I'm happier now than I've ever been. Happier. Am I glad I have cancer? No. But I'm happy how I've changed, and I'm happy the person that I've become through it all. You know, God's molded me and changed me into just the best version of Carrie.
And Carrie joins us now from Lee Summit at one of our infusion centers, along with her husband, Scott. Carrie is receiving treatment as we talk today, and we'll explain more on that here in just a moment. Carrie, in your story, you were determined to get that second opinion. Of course, hindsight 2020, but looking back, how important was that decision?
To get that second opinion, that meant everything to me. The peace that I felt walking in that day, it was definitely worth it, and I'm so thankful that I did.
Scott, you have been by Carrie's side for this entire health journey, helping her make those really tough decisions. What difference did finding hope make for your family as you all faced her breast cancer diagnosis?
It was a very dark time for our whole family, and as we were facing that, I knew immediately we had to get another opinion. And when we first walked into KU, I mean, there was a peace that came over us. We're very strong in our faith, and so we believe God had this under control. And when we stepped into KU, we knew without a doubt we were in the right place. So, and she's been amazing through the whole thing.
Well, let's bring in Dr. Ann O'Day, Carrie's medical oncologist, and Dr. Lindsay Kilgore, Carrie's breast surgical oncologist. And Dr. O'Day, you gave Carrie a really tough cancer diagnosis to hear, and then you proceeded to tell her, though, that it was going to be treatable and that it was beatable. Where did that confidence come from?
We understand that with breast cancer now, with all of the advancements in treatment and local therapies, systemic therapies, and targeted therapies, that the overwhelming majority of breast cancer patients are going to do so well. And Carrie, you know, when I met her right away, you're just inspired by her positivity, her joy, her energy. So I knew she was going to tackle whatever it is we threw at her. I knew she was going to meet the challenge and rise to the occasion, and she absolutely did that.
Dr. Kilgore, you also provided hope because you started talking early on about really the big picture, including reconstruction. You performed Carrie's double mastectomy. At what point did you talk about the choices that patients have when it comes to reconstruction?
Yeah, I think it's really important in the beginning, especially when someone needs to undergo that chemo treatment ahead of time, to know that we're looking at the big picture. And it's not just about all the chemo that you're going to have to go through. And chemo's not fun for anyone to go through. But I wanted to say there's light at the end of this tunnel. We're going to get you to that point. We're going to get you the mastectomies, get you the reconstruction that you need. And don't get bogged down on all these details that are so overwhelming right now. That's why we make it a point here at KU to touch base with our patients multiple times during those treatments before surgery to say, okay, you know, what are you thinking now? How are you feeling now? Because sometimes when you come in, you're just like, I'm going to do this and I know it and this is the way it's going to be. But then when you think about it more and you hear the data and the facts behind it and what's going to be right for you, you don't just jump to conclusions. And so I think that's kind of what I was trying to show Carrie, is that we're here to support whatever you want and what you feel, and that there's time to think and decide, and that just choices don't just have to be made right now.
So during Carrie's surgery, you checked for lymph nodes. Why do you check for lymph nodes, and did you need to remove any? And then how does that later impact her recovery?
Yeah, so lymph nodes are an important part of breast cancer treatment and staging. They let us know if cancer has started to spread or not, which can impact what treatments she gets that Dr. O'Day may or may not recommend. And so it's really important for breast cancers to have that lymph node evaluation. And specifically for Carrie, since she didn't have an advanced breast cancer, we were able to do the more sampling of the lymph nodes. Most patients, when they come to me, they're worried about having lymph nodes removed because of the risk of lymphedema, the arm swelling that people talk about. But Carrie's risk was very low because she had the sampling alone. But here at KU, we monitor all of our patients for that. And I think Carrie, she can speak for it, but I was very reassured by the comprehensive lymphedema program that we have that she was going to get taken care of and monitored for that.
Well, Dr. O'Day, you diagnosed Carrie with HER2 positive. That used to be one of the worst types of breast cancer, to get that news. What's changed with the science that makes it much more treatable now?
We really understand what's driving or feeding, controlling the cellular signaling of this particular phenotype of breast cancer. It's about 15 to 18% of all breast cancers, but we probably understand it the best of all of the subsets. And I really believe in Dr. Kilgore in my lifetime as breast cancer physicians that we will have a cure for this type of breast cancer.
Such good news. When we introduced Carrie, we mentioned that she was getting an infusion today. Why is she getting this infusion, and what is it?
The infusion she's getting today is a combination of two targeted therapies, trastuzumab and pertuzumab. These are monoclonal antibodies which are designed to specifically target that cellular signaling pathway that is overexpressed in her type of breast cancer, which is called HER2. HER2 are receptors that are expressed on the surface of lots of healthy cells as well, but in certain types of cancers they are overexpressed, and so that serves as a very potent target that we can use targeted monoclonal antibodies and really put the brake on that signal for those cancer cells to grow. So partnered with chemotherapy, those two things can work very well together.
Carrie, I love it when you say you are now the very best version of yourself. How did you come back from what you called such a dark place to now being so hopeful?
Well, God, first of all, my faith, which I talked about in my video. Definitely the support from Scott and my family, and my friends and my workplace. I mean, just all of those different things rolled into one.
Well, Scott, what has it been like for you to see this transformation in Carrie?
I love how it's really opened her up to the community and to her friends, her co-workers, in helping get the word out to preventative care, making sure that you stay on top of your preventative stuff, because that can make all the difference between getting a death sentence or hope. And that's what we got when we went to KU, is they gave us hope. And that's what she was able to build on. And I think that was the key to her success through this.
Well, we have some questions from the community about breast cancer. The first one is from Johnny. He wants to know, should every patient diagnosed with cancer get a second opinion?
What I always tell patients is you need to find the closest NCI-designated cancer center to where you live and really go and get an opinion. Make sure the pathology and the treatment plan, the surgical plan, the medical plan, make sure that that's all been reviewed. And then once that has been done, if the treatment is similar to what they're recommending in the treatment facility that's closer to your home community, then that's completely fine. But when we're dealing with cancer, really we have a saying that the tissue is the issue, and that is that the diagnosis that the pathologists provide for us really serves as the foundation for what medicines, for what surgeries in some cases, for what types of radiation are going to be the principal focus of the treatment. And if that foundation is not correct, then our treatments will not be correct or not be optimal. So really, I think at the time of diagnosis, getting a second opinion, making sure that the diagnosis is correct, making sure that the treatment is multidisciplinary, and that really a team of experts have looked at the treatment plan and confirmed that that is the way to proceed. So again, I always also say that for the majority of cancers, these are not cancers that are growing by the hour in most cases. And so there is time to get a second opinion. If there ever is a medical facility where someone is making you feel pressured or rushed, you have to start treatment tomorrow, most of the time, I think you should probably question that. Usually there's time for a week, 10 days, 2 weeks to get another opinion, and then there's plenty of time to move forward in an expeditious way, but just make sure that that foundation that's going to determine the mainstay of your treatment is correct.
Becca writes that she has a friend recently diagnosed with breast cancer in her mid-30s. How common is that? What are the current mammogram guidelines?
We are seeing breast cancers in younger patients currently, and we actually speak about it often, that everyone needs to really undergo a formal risk assessment to know their family history, to know what risk they're at increased risk of, and then therefore, based on how high risk a patient may be of developing a breast cancer in their lifetime, then we adjust screening guidelines based on that.
I want to wrap up with some final thoughts. Carrie, what would you like people to know?
I mean, I can't say it enough. You know, and I've got my friends going to KU, and I just am so thankful, and it's such a blessing that they're in our backyard.
Well, I would say the reason we got the second opinion is because we still had questions after the first, and I think that should trigger somebody to want to get a second opinion. We're just very grateful for where we're at right now and where we've come from, and we're looking forward to the future.
Well, we thank you both for sharing your story, and we wish you both so well. Dr. Kilgore, final thoughts?
Yeah, first of all, Carrie's a rock star, and like she mentioned, you know, it is the whole team. So, you know, everyone at KU, when you get that second opinion from the pathologist, the breast radiologist, the nurses, geneticists, you know, reconstructive surgeons, I just want to emphasize that KU has the best multidisciplinary team here. And it's not just myself and Dr. O'Day, but everyone else that goes into Carrie's care and everyone else's. So KU is just a great place to work and to be and to take care of patients.
Dr. O'Day.
Yeah, I think we both feel very honored to know Carrie and to know Scott, and you've always done every single thing we've ever asked of you, and you've done it with grace and positivity and hope. And Carrie, I second what Scott has said. I feel like you are just this butterfly that has emerged over the course of this treatment. I remember the first day I met you, and you were a little bit stoic and said, well, I'm not going to share this with anyone. I'm a very private person. And then next thing I know, you're having the fundraiser at school, the awareness events, you're willing to go on the news with us and share your story to the benefit of other people. And to see that metamorphosis is just such a gift, and we're honored to be a part of it.
And we want to thank all of our guests for joining us today. Thank you, doctors, for being with us. This has been such a great half hour of patients, their choices, hope, and science.
I agree, Jess. It has been fantastic, and we hope you've enjoyed this program as well, and that you would like to see more. The good news is you can, every weekday morning at 8 a.m.
Please join the conversation on Facebook and on YouTube as we live stream patient stories with the specialists making a difference.
Thank you again to our guests.
And thanks to you for watching. Coming up on the next Choices, Hope, and Science.
There's hope that there's a chance to take that one step, and there's really no limits at that point.
Functional gains.
Functional gains, right. I'm just stimulating right there.
It's slow progress, but it's been tremendous.
I'm more steady on my feet and more willing and able to walk a new lease on life in many ways.
A cancer diagnosis can leave you feeling stunned and overwhelmed. But at the University of Kansas Cancer Center, you don't have to navigate your cancer journey alone. From initial diagnosis until your treatment plan is established, our nurse navigators are there every step of the way. For information on our Nurse Navigator program, please call 913-588-3671.